The Ford government's decision to reopen bars, restaurants, and theaters on January 31st is good news for many, though it's also an infuriating decision for the thousands of Ontarians waiting to have vital surgeries.
Why is my sister still waiting for a life-saving cancer surgery?
To protect his sister's privacy at this difficult time, we're only using Michael's first name.
My sister was diagnosed with kidney cancer on January 13th. She received a call that the surgery was canceled due to lack of beds. It's devastating that we could not get a date. Even after talking to the surgeon again today, still no concrete date on when she can actually get a surgery.
On January 4th, the Ontario government directed hospitals to postpone all non-emergent procedures to open up hospital capacity for the surge of COVID-19 patients.
We also know, for example, cancer surgeries have gone delayed. We have colonoscopies and mammograms for screening of cancers that have gone delayed. It's also access to primary care and mental health care services. Any delay in care can have an impact severely on patients and their families.
I'm very concerned about my sister's life.
Yesterday, the CEO of Ontario Health spoke of the pressure on hospitals.
We do have a number of hospitals that are operating at over 100% occupancy in their ward beds.
24 hours later, Premier Ford had this to say.
These are challenges our hospital system can manage. We can be confident in our ability to care for people, to provide hospital beds to those who need them.
However, that's simply not the reality for thousands of citizens.
There's zero capacity at the hospital, but they're going to open up capacity to bars, restaurants, and everything else. I mean, I own a small business myself. I'm all for it. But when you look at it from a different perspective, it makes no sense.
The balance is almost impossible to understand, and that's why it's so very, very difficult.
Professor KERRY BOWMAN is a bioethicist at the University of Toronto.
You know, ethics is proportional. What are the risks? What are the balances? The best way to, go to war with this virus is to stay locked down until spring. But absolutely not. I think a lot of people are beginning to think, we've got to find a way to move forward as we enter year 3.
When asked why his government is reopening bars and restaurants while surgeries are still ordered to be delayed, Ford pointed the finger to both the previous federal Conservatives and the current Liberals in Ottawa, saying more sustained healthcare funding is necessary.
If it was your loved one, your mother, your sister, your brother that was going through this and got told to wait twice for a surgery, a potential life-saving surgery, would that be acceptable? That's my message to the government.
Experts warn even if Omicron cases spike tomorrow, we won't see that reflected in hospitalizations for at least another 2 weeks. The Ontario Medical Association says pandemic backlog has resulted in nearly 20 million healthcare delays for Ontarians. I'm Adrian Ghobrial for City News.